So let's define some of the terms that we're going to address in this talk. Rehabilitation, or what I do as a physical therapist, we're trying to restore normal mobility, normal motion, normal strength and function after surgery or perhaps after an injury, or even in injury prevention. And performance training is what they do at Combine and Blue Streak, for example, trying to get a quote-unquote normal female patient or athlete back out onto the field and improve their sport-specific skills. But it's never this clear-cut specifically with female patients and female athletes, and a lot of that has to do with function and function for female patients specifically. So functional training essentially is a trend in therapeutic exercise that takes us away from the gym and the typical machines that we see at the gym and takes into account more the whole body, the kinetic chain, for example, from your foot all the way up to your head, and how you move in space with your specific tasks throughout the day. And function for women is much different than function for men. And this is all kind of general rule. I don't want to get into female versus male, but essentially what we see as in our female patients, what they have to do throughout their day is a little bit different than what a typical male patient has to do. And so carrying items up and down the stairs, doing laundry, reaching overhead, their recreational activities are somewhat different than a typical male patient. And the reason we can't just do PT and then send them off to performance training is because a female patient might not engage in anything athletic, but picking up a toddler who's 30 pounds into a car seat 5 to 10 times a day is pretty athletic. That's like squat lifting a 30-pound medicine ball. So there's a lot of gray and crossover over what we do with our female patients because their function is actually pretty high level, what they do at home. So with female patients and athletes, we're going to talk about in this lecture different types of injuries that we see. Are there any gender differences in their physical healing? Are there any gender differences in the mental aspects of healing? Differences in function, which I was just speaking about, and then general injury prevention strategies. So in my research, I found that there's a higher percentage of non-contact injuries versus contact injuries in female athletes and patients. There's a higher percentage of overuse injuries and overuse training in female athletes versus males. And a couple terms we come across in the literature are yoga butt. Okay, yoga butt is a completely unscientific term for general butt pain and hamstring issues and hip issues that mostly female, I can't say I've ever had a male patient with yoga butt, mostly female athletes and female patients get from overdoing it with yoga. Overuse injuries related to running. Definitely saw quite a few patients recently who were training for the marathon and ended up with pain and injury at the ONS clinic. There's a higher percentage of female athletes with chronic pain and female patients with chronic pain, specifically to the neck and the shoulder, and a higher percentage of females with autoimmune diseases, which may or may not cause pain and injury. When it comes to actual physical healing or physical training, when the evidence is pretty clear for age-matched controls, you can take a female athlete and a male athlete, both sexes improve their overall strength, endurance, cardiovascular endurance, performance, similar to males, although as we can see in our everyday life, females don't necessarily get as big as males, so not as much muscle hypertrophy. But when it comes to healing, there's a big not a big difference, but there is a difference between females and males, and a lot of it's related to estrogen. I mean, that's the hormonal difference that separates men and women. The evidence on estrogen and the purpose of healing is mixed, though, and it is considered a double-edged sword. So there's a lot of evidence to support that estrogen actually minimizes muscle inflammation and improves overall muscle health after a given intense workout, for example. And I can say that anecdotally, I could take two 18-year-old athletes, male and female, put them through the same exact rigorous program, and the guy will come in the next day and say, "That killed me, I'm so sore, I could barely get out of bed," and the girl comes in ready to do it the next day. Right? So that's my general rule of thumb from my experience. Estrogen obviously helps promote bone growth, and when you lose your estrogen, and there's a risk of increased stress fractures. But estrogen receptors are found all over the body, not just to do with the menstrual cycle. And estrogen has to do with a lot of metabolic processes. On the flip side, the double-edged sword side, there are a lot of possible negative effects to having estrogen related to these chronic inflammatory conditions and autoimmune diseases, and so therefore it's a double-edged sword. Psychosocial aspects of healing. You know, I started doing my research and I thought I'm going to find all this data to support that women are the stronger sex. And then unfortunately I found that there's actually greater pain associated with female athletes and female patients versus males. There's a greater frequency of musculoskeletal pain and a greater incidence of chronic pain among female athletes and patients, a greater incidence of comorbidities like diabetes and obesity, thyroid disease, and all of this goes towards that trend of that that chronic disease state or chronic pain. But then I thought, this is awful. I need to find something good. And I found that there's a lot of data to support that despite all that horrible stuff about pain and injury for females, there's overall a decreased incidence of lost productivity. So less time away from your work and less time away from your sport for female athletes and patients, even though they're dealing with perhaps a greater incidence of pain and injury. So, and that definitely holds true in 13 years of experience. I oftentimes will have female patients right back to the work of mom, right? And right back to the work of work, whatever they're doing, or right back to their sport despite their pain. And I also wanted to bring up 6 years ago when we did a conference here on the ACL epidemic and Michael Sokolov spoke. He's the author of Warrior Girls. He wrote in his research with military cadets, female military cadets, it was harder to take an injured female out of practice and out of serving with her team than it was for a male. And I think that is a testament to females basically being able to manage and cope with pain a little bit better than males. Sorry. So let's talk about functional roles. A lot of times we think about women in the workplace and the more laborious roles like construction and labor, utilities, transportation. Only 4.1% on average females participating in those work roles. But physical childcare activities, I just wanted to note, on average, a stay-at-home mom, which it looks like the rates of stay-at-home moms we're swinging back the other way compared to 1999. We went from 23% of females staying at home to now 29%. But physical childcare activities in a self-reported study at the Pew Research Center, 8.3 hours per week. That doesn't sound like a lot, but how many of us actually exercise 8 hours a week? I mean, let's be honest. Even if I give you an hour a day, every day, that's only still 7 hours. And a lot of our female patients are exercising and participating in fitness activities while also maintaining the physical work at home, which could go from anywhere from 4 hours for the working mom to 8 hours for the stay-at-home mom. That's a lot of labor. That's a lot of physical activity. And so that's why there's a lot of gray area with performance training for females. It's not just about throwing a ball or a great kick serve. It's about squat lifting. It's about being able to fold laundry for a half an hour without back pain or neck pain, okay? So injury prevention strategies to address all of this when it comes to the female athlete, we want to focus on joint protective strategies. A lot of the exercises that they participate in the majority in this area, there's bar classes, there's yoga. Some exercise regimens in this area tend to focus on very end-range positions and postures, and we want to focus on more joint protective mid-range positions and postures. Weight bearing, we want to keep it functional because, you know, a knee extension machine at the gym is not going to help you put your 30-pound toddler in a car seat 10 times a day. We want to make it functional, specific to their work tasks, specific to their home tasks. We want to emphasize eccentric exercise, which is well known in the literature for injury prevention techniques for tendons and muscle injuries, and a lot of education about which exercises are really healthy for you and which exercises might just be a trend or a fad. And having said that, I wanted to speak a little bit anecdotally about what we tend to see in the clinic, and Dr. Cohen, I'm sure, can attest to this. The girl in the pink, really, there's nothing in the research that shows that's good for health. In fact, I think there's a lot of research trending saying that that's not good for your body in general. And it's tough to tell a woman that sometimes. And again, not that men don't do yoga, but usually we see this more in female athletes and female patients. The girl in the pink on the right is certainly potentially doing some damage to her hamstrings, her hip joints, her buttocks, her lumbar spine. And then the runner, I just want to talk about, in general, training issues. So we see a lot of female runners who just tend to do too much too soon and develop those overuse knee pains, hip pains, stress injuries, foot pains. And so anecdotally, with female patient, I hear female patient, I think runners and yoga, and there's a lot of education needed as far as preventing injury for that population. Thank you.